Good day, everyone. My name is Ayanshina, and I work in healthcare. Today, we'll be talking about the tips on how to complete job application and also what to do at an interview in healthcare. And we'll just dive straight into it, really. Just in case you're wondering, I've got the CIC I work for as well. We're called auxiliary initiatives, just in case you have any questions or any queries. Yeah. So thank you, Creed. Thank you, Brashion Olabode, for this opportunity. I do not take it for granted. And let me start by sharing my screen right now. I hope I know what I am doing here. Yeah, I can see the share button. Yeah. Mm, yeah. So yeah, this is the PowerPoint we'll be using today, and we will start from the beginning. So yeah, as I said, I am representing auxiliary initiatives right now, and um, I'm representing myself. So yeah, we'll be talking about the tips on how to complete a job application to ace an interview. When you see a job interview, what comes to your mind? Do you just apply for any job to any job? Yes, I'll say yes. Many people do. And I think this is one of the reasons why we often think about, get a lot of, unfortunately, on this occasion, because you can imagine someone who's never had anything to do with data, but just thinks that, oh, it's just to put some data together, maybe data entry. No. And then you apply for data analyst job, and you think they'll actually call you for an interview. No, that'll be a waste of time for you and for the interviewers. So yeah, when you see a job, you read, you go straight to the job advert. And when you go to the job advert, what do you see? Some jobs are, it's written clearly there that they're permanent, some are fixed term, some second secondments. And so when you say fixed term and secondments, they means the same thing. You see, if you read through, you'll find out that they're either for 6 months, they're most of the time they're for 12 months. So, or 2 years, 3 years. You'll see, it's clearly always clearly written there. Some interim and fixed term, they're, more or less the same, but just in case you see that it's still fixed term secondment. And you see part time. So the part time, you see the hours there 20.1 hour, 11 point something hours, 36 point, I mean, that's 7 hours. So do not shy away and say, oh, yeah, you applied to a job and you were not given. I mean, you applied to a job and you have I'm not saying you don't have the faith. Have your faith. However, think about what you're applying to. Is it realistic? So when you see a job, for instance, a job now, you've already chosen, you've said that, okay, this is what suits me. Is it part time? Is it full time? Is it permanent? And then what do you do next? Go straight to read about the job description. So as I said, still the example of the data analytics or an analyst, for instance. So you go to apply for a job that you did not read the job description. What do you think will happen? So what we're trying to do here is at least the obvious things that can get us rejected. Let us not do them. So the first thing you want to do, you want to read about the job description. So for people applying to jobs in the healthcare setting in Scotland, if you look through and then you see the job adverts, at the end of the job description attached to the job advert, you will have a table summarizing everything that you need to be able to apply for a successful job, um, at least to ace the interview, for instance, in the first instance. So we have the essential criteria, we have the desirable criteria, we have the skills needed, we have the values that you need to align with. What is your experience? And do you have the system or the software that you need to use to apply for this job or to even work on the job? So go to essential criteria. One of the essential, I mean, in the essential criteria, they will tell you there that these are the qualifications they need. So for a nurse, for instance, they need you to be registered with NMC in the UK. For healthcare support worker, you don't necessarily have to have any degree. They'll tell you that, oh, they need you to know mathematics or they need you to have English qualification at GCSE level. Not They're not asking you for like PhD in English, no. So that's the essential criteria. I mean, and then the role of a prescriber, for instance, you need to be a non-medical prescriber or a medical prescriber. So what are the desirable criteria for healthcare support worker? What are the things they need? I mean, the desire you have. They will desire, some of them, they desire that, oh, that you've had experience working in NHS. They will write it there. However, this is not mandatory because training will be given. So if you have an experience in NHS, for instance, is not essential, but is under this desirable criteria. Even if you've not worked in NHS, you can apply for that job. And then the skills that you bring as a healthcare support worker. What are your skills? You must be able to communicate to start with. Communication, you must be able to speak in English because this is that's the lingua franca here. So you must be able to speak in English. You must be able to write. So that's still part of communication. You must be compassionate. You must show and be you must be able to show empathy. So those are the skills that you need. You must have, I mean, the skill of, emotional intelligence. You've been able to mitigate a hot, fiery situation. You must have those skills. You must be able to prioritize your workload. You must be able to work in a busy environment and still stay afloat. When we say busy environments, you can imagine you working in emergency department, for instance. It could be very busy. But in the midst of all those busyness, you must still be able to say you're still there and keep your focus. So what are your values? They'll write the values there. These are the values of the trust you're applying to. So each trust has got their own value. So when you now get in that trust, your own values more aligned um to the values of the trust you're applying to. So the value of a trust, for instance, can be to prioritize patient safety, and commitment to staff development. So that must be your own value. And when you're completing your application, it must reflect in your application that you actually align with their value. So your essential criteria. So all these things that we're talking about, even your experience. So for the experience, let me just run through this and then we'll now talk about you completing your application. So experience could come under essential or desirable criteria. So some trusts will tell you it is essential for you to have worked in NHS. Some will say it is desirable for you to have worked in NHS. However, that won't discourage them from shortlisting you, from employing you. And then when you talk about the system, Probably the you can only apply to the job using Edge, Microsoft Edge, or Gmail or Google website Chrome, or maybe Opera. Anyone to let you know, and then to know that, and in some other cases, you must be able to use the software because the way documentation is going, I mean, is going through now in NHS, we document online. Yeah, so you must be able to use information technology system, computers, basically. So for some jobs, I mean, they still use the CV. So what should your CV look like? Your CV must be clear. It must be tailored. So when we say tailored, we're not saying tell lies on your CV, but it must be tailored to the job you're applying to. And in this situation, you have some skills that you have acquired in the past. For instance, you looked after your grandmother. You've already assisted her with personal care, um, helped with dressing up. Those are the things that should reflect on your CV when you're talking about you wanting to work as healthcare assistant or as a nurse in the healthcare sector. It must be easy to read. You don't need to put any jargons there. Just straight to the point. 1 to 2 pages and then achievements focused. So the structure of your CV, this is just how an example of how it should look like. Your personal profile, your key skills. We're speaking about the skills needed. Your work experience. What are your work experience? So now you're talking about you working in healthcare setting. Will you put your plumbing experience in there? No. Except if your plumbing experience has transferable skills for you to exhibit in there in the healthcare sector as a healthcare assistant, which I don't think so. Well, let me take that back. You might be able to prioritize, being a plumber, being a cleaner, your level of hygiene, you're, conscious of I am hygienic environments and things like that. Hmm? And then your education and training. So as we always say, I mean, I'd been to an interview before, and all they needed was just, honestly, was just my school certificate, secondary school certificate, not even my university. So if you're going for healthcare support worker, I think your BSc, your first degree is just perfect. And then the trainings you've had. So if you go, there's so many websites now with free trainings. If you go to allison.com, I mean, I don't have any partnership, I'm not being paid for this, but if you go on allison.com, and you don't need to get the certificates. So just to let you know. So if you go on to allison.com, you get so many trainings there that are applicable to your job, and then your achievements, and you put at the very end reference to be provided on request. You don't have to like share everybody's your referee's details because of GDPR. So writing a strong personal statement. So this will now I'll take us back to this slide here. Essential criteria, desirable skills, values, experience, software, and system. So, in order for you to be able to write a strong personal statement, you must have at the back of your mind the job description. Who are they looking for? What are they looking for in the who that they're looking for? And this will help you to tailor them into just these four sections. So, the introduction, who are you and where are you coming from? The main body will now encompass all the things that are the essentials and all the desirable, which will be a bonus for you. So as I said, the desirable are not they're not mandatory, they're not compulsory for you to have. But then if you have them, you put them in. And then you now give examples When you give this example, you use the STAR method. And the STAR method talks about the situation, the task, the action, and the results. So in the main body, you've already told them that, oh, that's your value aligns with the value of the trust, that you show empathy, that you are very compassionate, that you protect. So these are the buzzwords you should put into your application. Remember, empathy, compassion. If you go and check for the 6 C's, you're caring, you're compassionate, you committed, you protect the dignity of your patients, you know about confidentiality, you respect them. So these are the things. So it's like you trying to sell yourself to say, these are the values and these are the things I possess. This is the reason why you should hire me. And then when you now go to the examples to the using the STAR method, so you talk about a situation where you showed empathy, a situation where you showed commitment, a situation where you reflected your ability to be a team player, a trustworthy person, and then you talk about the task. So um, let me say protected in dignity, for instance, or let's talk about confidentiality because that's one of the things that's really, really at the heart of healthcare now. So you were on the bus, and one of your colleagues was on the phone to another colleague, coincidentally, and then you found out they were mentioning a patient's name. That, I mean, is in your care. What do you do? So what's the task? The task is to go and tell your colleague that, sorry, you need to stop. And then what is the action? Your colleague stops. And what is the result? The confidentiality of that person is protected. So on the word, for instance, a situation where you showed compassion, probably you had a patient that had a like that was going into surgery, for instance. So the patient going into surgery, of course, will be anxious because they don't know if they'll come out alive or not. So what did you do? What was the task to prepare them for surgery? So maybe to give them medication, change them into a hospital gown and things like that. What is the action? So you did help them to change, and you now try to like calm them down by listening to them. So that's you showing empathy and a caring nature. So you listen to them, you did not dismiss their feeling. And what was the result? They went into the surgery smiling. And by the time they came out of surgery, the anxiety wasn't there. So you can see what the STAR method can help you do. And if you do it systematically, you will not skip any step. And then you now write in conclusion. Then in conclusion, having exhibited all those, your values align, your experience in the healthcare, and all the examples that you've shown with good results. Yeah, that you believe that you're the most suitable candidate for this job. So yeah, as I said, the STAR method. We talk about the situation, what was happening. Probably the patient is in end of life. So definitely you will have families around if they have families. So you have families around wailing and sad. What was your responsibility? Your responsibility is to meet that patient, whether you're a healthcare support worker or you're a nurse or you're a doctor, is to meet the last um, face of that person on the surface of the earth to make them comfortable. What did you do? You make sure that you reposition them as often as possible. You help them with personal care. You did not say, oh, because yeah, they're dying and they've just become incontinent of physics, that you just leave them like that. No. You show the family compassion, you make them, you prepared a cup of tea, you gave them, even if they say no, still prepare the cup of tea, still put the coffee, the tea, the hot water, the milk, the sugar, put it there, and water with ice. And then going from time to time to wipe the patient's face, do regular oral care. And what was the result? The family was so contented that their loved one passed away peacefully and well attended to. And sometimes, probably, you got an award. So now you've already written all your, you've applied for the job, you've been shortlisted. So what happens before the interview? You go back to the job description, you review it, you prepare star stories, you practice common questions. One of the common questions, in fact, the commonest question will be, tell us about yourself. Prepare questions to ask the panel. So, as I said, common questions. Why do you want this role? Describe a time you worked in a team. How do you handle pressure? But always remember that we ask you, who are you? And when they say, tell us about yourself, it is not a time for you to say, oh, my name is Lali Ayanshina, and I live in so place, I have this family number of family. You're there to impress them, tell them that I'm a charismatic person who communicates them excellently, both in written and documentation. I am empathic. I show compassion. Yeah, those are the things they want to hear about you. And the way you articulate, you don't have to rush it. The way you articulate goes a long way to, them being able to listen and understand what you're saying. So focus on NHS values. So this is one of these are values of one of the trusts. I can't remember the trust that I used here, but the values are compassion, dignity, respect, teamwork, quality care. So in every, I mean, so let's just take that I'm applying to this trust. Everything I say must exude. These are the buzzwords they want to hear. These are the buzzwords, and then you prepare your your star examples in alignment with this. The time you were compassionate, the time you showed dignity, the time you showed respect, the time you showed teamwork and quality care. And then the supporting statement saying, address every essential criterion. Everything addresses. Even if you don't have it, tell them you don't have it. But you're working towards it. For instance, some people they require SVQ2, SVQ3 as healthcare support worker. Use STAR for each example. Show commitment to patient care. So, in summary, key tips for your NHS interview: you reference NHS Trust 4 values by name when possible. In Scotland, mention the what matters to you. So, that is a very heavy buzzword: patient centered care. So, in the time past, you just find out that today we're having oat and service, oat cake and service for lunch. For dinner, we're having salad. That's what used to happen in the time past. But now you ask them, what happens to you? I mean, what matters to you? Some patients, they're not morning people. So they sleep till for instance, people that have worked in night shifts all their life, you don't expect them to be morning people, do you? So the body system, for some people, their body system has already aligned to sleeping till maybe like 12 a.m. So don't go near, they'll tell you in the what matters to me, do not come near me. Except maybe they want to take their medication, or there are some procedures that are compulsory for them to do in the early hours of the morning. Otherwise, do not go near them. Some people on their official government's name is Christopher. But what matters to them is that you call them Bob. Yes. So if you call Christopher from now to tomorrow, you might not get a very good response from them. But if you call them Bob, you get, in fact, they will do everything and anything that you ask them to do. So always stress that you work with being your competency and escalate concerns to registered staff. Even if you're a registered nurse, make sure that you still speak to your senior child nurse. If you're a healthcare support worker, don't say because you have an MC pin, but because you don't have a nursing job at that moment, that you will now take things into your hands and say you're doing it. Mm-mm. You see a patient that has passed out, what do? You follow the steps of for BLS. And once the main guys are there, yes, you can do CPR. Yes, you can do this. But once it leads to maybe like they have to give adrenaline and all this stuff, you don't say, oh, let me go and bring the syringe as healthcare support worker. Mm-mm. Use staff formats for all competency and scenario questions. And then you show enthusiasm for the setting specifically. It's different from hard work, and interviewers want to know that you understand that. So, and you being enthusiastic, you being committed is different from you from the word work. Now, the body language and confidence. Oh my goodness. When you go there, remember I said, do not rush your answers. Do not speak too quietly. Be coherent, clear, and concise. Do not undersell your achievements. So they want to hear about the things you have achieved using your STAR method. You can't afford to be humble at this game, and you can't afford to be too proud as well. So when you come in into the interview room, if they don't ask you to sit down, don't sit down, no. And when you sit down, you sit upright. Not that the one that you're already used to, slouching. Mm-mm. For those 30 minutes, 20 minutes, you sit upright. Make eye contact. Just in case in your culture, making eye contact is being disrespectful. In this case, you have to make eye contact to them. You smile. I know you're under stress. There's nobody that even if I go for interview today, I will still be like fidgeting. But smile, speak clearly, and pause before answering. So as they're asking you the questions, I know you're processing the responses in your head, but still have a little pause, not too much, not too long, and not too short before you answer. So the questions you can ask the interviewers: what does success look like in this role? How does the team support new staff during induction? I think that will be my go-to question actually. And then how does this department embody NHS Scotland's value in daily practice? What opportunities are available for development and progression? And after the interview, what do? You reflect on what went well, what you can improve, questions you struggled with, how you can prepare better next time. To be honest, the Bible says something that the horses prepare for the day of the battle, but the victory belongs to God. So don't ever think, oh, I'm so prepared. And then, yeah, I don't think I'm underprepared. I'll get the job or I don't get the job. God gives the increase. So don't be too hard on yourself. Final checklist before submitting your application. These are the things you should look out for and examples of questions and answers. So tell me about yourself and why you want to work as a healthcare support worker in our department. What do you say? Oh, my name is Bolanle Toye. I was born so. No. Just have a genuine compassion for supporting people during what can often be a stressful time in their lives. I'm drawn to the outpatient setting specifically because it involves a high volume of patients with varied needs from routine appointments to complex conditions. And I enjoy working in a fast-paced, organized environment. NHS Kingswell serves a close-knit community of 300 people and I want to contribute positively to that. I believe my communication skills, my calm manner, and my commitment to person centered care make me a strong fit for this role. So the second question, what do you understand about the role of a healthcare support worker in an outpatient department? And then you have this. The third question, NHS Borders has four core values. Can you tell me about a time you demonstrated one of these values? So we talk about the situation, we talk about the task, we talk about the results, we talk about the action as well in between using the STAR method. So the situation in my previous role as a care assistant, I had a patient who was visibly distressed before a procedure. What was the task? My task was to take the observations, but I could see they needed reassurance first. And then the action, what did you do? I sat with them, introduced myself calmly, explained what I was going to do step by step, and gave them time to ask questions. I didn't rush. And what was the result? The patient visibly relaxed. The observations went smoothly, and the nurse commented that the patient had been much more cooperative during the procedure. That experience reinforced me that care and compassion isn't separate from clinical work, it's part of it. Thank you for listening, and that's all I've got for you. So if you want to, now I need to look for my video. So look at my video. I got there eventually. Yeah, so that's all I've got for you today. And if you have any question, if you need a one-to-one um, help, I believe the church has the job clinic, yeah, that one. Or if I'm available, I'm happy to help. All right, take care. Bye.